I want you to set aside other tasks which may disturb you while enjoying the lessons. Follow carefully all the contents and instructions indicated on every page of this module. Write in your notebook the concept about the lessons. Writing enhances learning, which is important to develop and keep in mind. Perform all the provided activities in the module. Use a separate sheet of paper in answering the exercises. Finish the task at hand before proceeding to the next page. Analyze conceptually the post-test and apply what you have learned. If you encounter any difficulty in answering the tasks in this module, do not hesitate to ask for help from your teacher. At the end of this module, you are expected to describe how global health initiatives positively impact people's health in various countries. G. Analyze issues in the implementation of global health initiatives. What is mental health? According to the World Health Organization, mental health includes subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. Facts about mental health. 1 in 5 young people, aged 13 hanggang 18, has or will develop a mental illness in their lifetime. Youth depression rates have risen from 5.9% to 8.2% since 2012. Depression symptoms can impact performance in school and interfere with personal relationships. Mental illnesses can affect people of any age, race, religion, or income. A mental illness is a medical condition that disrupts a person's thinking, feeling, mood, and ability to relate to others and daily functioning. Global health initiatives are programs and projects which help to address global health issues, concerns, and trends. Some of these health issues, concerns, and trends are about mental health, pollution, climate change, environmental sanitation, tobacco control, harmful use of alcohol, and prevention and control of communicable and non-communicable diseases. In May 2013, the 66th World Health Assembly adopted the Mental Health Action Plan for 2013-2020. This action plan was extended to 2030 at the 72nd World Health Assembly to ensure its alignment with the 2030 Agenda for Sustainable Development. The plan will help countries achieve Sustainable Development Goal Target 3.4 by 2030. Reduce by 1/3 premature deaths from non-communicable diseases through prevention and treatment and promote mental health and well-being. The action plan was developed in response to the growing burden of mental health disorders and the challenges that health systems around the world are facing to respond to the needs of people with mental health problems. The action plan is a landmark achievement that focuses international attention on a long-neglected problem and is firmly rooted in the principles of human rights. Comprehensive Mental Health Action Plan 2013-2020. The result of extensive research and consultation by stakeholders, member nations, academic and non-government centers across the globe. It should be impartial, life-based, and preventive in nature. Comprehensive Mental Health Action Plan 2013-2020 basically addresses the following: to fight and alleviate negative trends in mental health, to improve and make mental health services and care accessible, to prevent abuse of rights and unjust treatment against people with mental health problems, disorders, and disabilities which are still prevalent around the world. There is no health or sustainable development without mental health. Mental health is too important to be left to the professionals alone. And mental health is everyone's business. World Health Organization. Vision of the Action Plan. In a world in which mental health is valued, promoted, and protected, mental health disorders are prevented, and individuals affected by these disorders can exercise the full range of human rights and access high-quality, culturally appropriate health and social care in a timely way to promote recovery, all to attain the highest possible level of health and participate fully in society and at work free from stigmatization and discrimination. Objectives of the Action Plan. Strengthen effective leadership and governance for mental health. Provide comprehensive, integrated, and responsive mental health and social care services in community-based settings. Implement strategies for promotion and prevention in mental health. Strengthen information systems, evidence, and research for mental health. Source cited. Health Activity Number 1. If I will be. Direction. If you will be given a chance to be one of these people, what are the things you would do to achieve a mentally healthy society? Write at least 3 of your plans, actions in the space provided. Guide questions. What are the different issues in the implementation of the global health initiatives, particularly in the mental health of people in different parts of the world? What are the effects of this pandemic due to COVID-19 on the mental health of people in various countries? How do the international, national, and local government officials positively address the different issues of COVID-19, particularly in the mental health of people? Based on your observation and personal experience, what are the different issues and concerns that may contribute to why people suffer from depression and anxiety? For them to cope up easily, what are the things that you can advise to those people who suffer from depression and anxiety? Write at least 3 sentences. Activity number 2. Dealing with directions. Make a meaningful and significant slogan that shows how to maintain a mentally healthy society amidst global health problems. Do it in a long bond paper. Rubrics. For the activity. Content, 10 points. Word usage, 10 points. Understanding of the topic, 10 points. Beyond the classroom. Know the different global trends in improving healthcare, such as fighting communicable disease like tuberculosis, HIV AIDS, preventing maternal deaths and other health issues and concerns. List this on your notebook or activity sheet.